let me just say this, the energy that you give us is going to help us drive this conversation, right? What you just saw is about advocacy. It's about making us aware. And so whatever questions you will have, make sure you jot those down. Because as you see, we have a microphone, and we will have question and answer, but there cannot be anyone in this room who would not want more information. And so that is what we're going to do right now. So we have learned a lot just by the stories that we heard. And guess what? There's more stories out there that wasn't documented, right? So my spirit is driving me to go directly to our director with this first question and asking, what was the inspiration that you had with making Sister Doula? And how did that inspiration drive you to bring attention to what is happening in the Black community?
First of all, thank you all for being here, and thanks for everybody who set this up, KCMO Health and Uzazi Village and Hakima. Sandy did an amazing job putting this together. Thank you very much. So I was in Kansas City on a different project, and I was at dinner, and somebody from Surge KC was like, "Have you ever heard of Mama Hakima?" And I was like, "No, I don't live. I wasn't living here. I was just here on a project." And they just went on for like 15 minutes about what a badass she is. And so I literally contacted her the next day and said, "I heard you're amazing. Can I make a film about you?" And then we met, and then I started filming a week later, and filmed for about 5 years, not including COVID. So we like filmed a lot. It wasn't, the film didn't film finished to me because I really wanted to have a birth in the film, and none of the babies were helping me doing that. Their schedules were all over the place, and so the film took a long time. But the issue is so important, so it's impossible to not care and be passionate about it. But I also, my initial goal of the film was to have a film where only Black women talked, because that's not a thing that you see. And so it didn't quite work, but that was a goal of mine. And I wanted also to, in addition to the story, I also wanted to, keep those really long, I've been told a few times from people to like, those really long monologues that are happened a few times, or when like Hakima's talking for a while. I was like, no, I was advised sometimes to like cut those and chop them up. But I was like, no, I want you to sit and like listen to Black women talk, and because that's not a thing that we see enough. And so that was, all those things were the reason that I made this,
So then that brings me to talk to Ms. Hakima. As the film expert, and I think I heard a little bit about it, but I definitely want you to highlight it more. Like, what drove you to bring this to the attention? Like, what was it? And I think I caught a few things in there, but it was something that said this has to be more than just word of mouth.
Well, definitely I would say my passion for maternal infant health was definitely born in my own lived experience as a Black birthing person. I have 9 children of my own. They range from 18 to 46, and the last 6 were born at home with midwives, and I was a labor and delivery nurse. And just the contrast of doing home births, apprenticing with home birth midwives, seeing what maternity care could look like, was really a glimpse into a world that most people don't see. And then the contrast that with finishing nursing school, getting my first nursing job on a labor and delivery unit, which I was very excited to do because I was very passionate about birth. I'm still an L&D girl at heart. If I step foot in a hospital, it's only because I want to be in labor and delivery. And but from the moment I arrived, I saw the difference. And And it was really stark. It was really startling for me to see how Black and brown patients were treated compared to white patients. It was just obvious. I could see it, and I was greatly perplexed and disturbed that everybody else claimed not to see what was really obvious to me because there was so much denial. And for a while I thought, well, maybe I'm the crazy one. Maybe I'm not seeing things right. And then after a while I said, no, this is really happening. These bad things are really happening. And I am seeing what I'm seeing. And it really, even though I loved labor and delivery work, it really drove me away from bedside nursing because I just couldn't bear how I saw patients being treated. And I thought there's got to be a better way. And that was really, that was really the impetus for the work, for starting, leaving nursing. I actually tried something else. I went into education, got a master's degree in nursing education, and started teaching labor and delivery. I thought I'll still have my hand on this. Maybe I'll produce better nurses who'll treat people better. And then there was all the racism that I encountered in academia. And I ran from that too, and ran straight into the world of nonprofit, where I just wanted to try some of my ideas. And they culminated in the Ida Mae Center. Ida Mae was my grandmother, so I named my clinic after her, but it's through the vehicle of that clinic that we create new systems. and I think that was, I think it was my own lived experience that made me think we can create ways of delivering health care to people that don't diminish them, that enhance the experience of pregnancy and birth, and that don't diminish them. And the core of that is really what I call culturally congruent care, that we're caring for Black women, and in the case of our Kansas office, we serve Spanish-speaking Latinas, and 100% of our staff in that office are Spanish-speaking, native Spanish speakers. But serving folks in a way that makes sense to them culturally, that serves the whole person, that recognizes them as a whole person, and that honors their humanity. That's really what we're doing at the end of the day.
Thank you. And what I noticed in the film about labor and delivery and being a nurse, that caught me to say, okay, there has to have had, something had to have happened for that switch. And so I think you somewhat explained it. As we heard some of the voices of the women who spoke, did you feel like your voice was kind of restrained watching that and knowing that there were some disparities that were actually happening right in front of you?
I think that still goes on today. I still have fears and concerns around something bad could happen right on my watch, and things have, even with Uzazi Village being there, with us acting as advocates, with the doulas out there advocating for folks, bad things are still happening. And that's why I stay on the message about the system needing an overhaul.
Absolutely. Dr. Jones, as the health department director, could you emphasize the importance of highlighting community-led solutions, such as doulas, in addressing Black maternal health care, and plus the disparities?
Yeah, when we talk about disparities, we really are talking about the differences. So disparities is just kind of like another word for differences. So we're saying there are different rates, whether for white and non-white people. And so what we're really thinking about from a public health department standpoint is health equity. Do people have the same opportunities to even have having access to a healthy outcome? And what we saw very clearly in this film and in the data that we've discussed earlier or shared earlier, we know that there is not equitable access. And so at the health department and on behalf of the city, our job is always to figure out how we can partner with folks who are doing this work, how to partner with organizations like Uzazi Village and others that are out there to say, what are we missing? You know, government cannot regulate everything, government cannot change everything, and we don't know everything. And so it is always important to talk to the folks who are on the ground, who are doing this work, and can say, hey, you need to focus here, shine the light there. And that adds the color and the life, such as this film, it adds color and life to the numbers that we look at every day.
Thank you. So a follow-up to that, when we talk about disparities, differences, as a health director, now having some focus in shedding a light on Black maternal health and, again, the disparities, the differences, as the health director, what kind of communications or feedback are you getting from the community of our efforts? And I say our efforts as a deputy, but our efforts in making sure that this information is brought to light in our city.
Yeah, I think people are still very frustrated. I think people hear a lot of data. They hear these sad numbers, you know, that we share. I'm guilty of it too. You know, as someone with a research background, I'm always going to lead with data. I'm learning to also lead with, yes, and I've lived this life as well. I have 2 children. I've gone through the birthing process. I've experienced having a doula, and I've experienced not having a doula. And so I understand people's pain, and I understand people's frustration. I think the feedback I've heard is we have to do better. And I was appreciative to hear this time watching the film of Ms. Payne actually saying, doulas aren't the only solution. This is a stopgap. This is a part of it, but the system has to be overhauled. I continue to hear that feedback from people saying, thank you for supporting doulas. Thank you for these summits and these policy discussions we've been having. Thank you for shining a light on this. But we really need you to hold the system accountable for what's going on.
So as Director Emmett, I know you're doing some traveling. This is not your first, your last screening to talk about the importance of just being aware of doulas and how they impact our community. But as you reflect on the film's impact, what profound insights or transformative shifts do you anticipate audiences will gain from their viewing experience?
Well, the biggest impact that this experience had on me was when you start talking about, when you want to make a film, you start talking about it just to see if people would be interested in the idea, or if it's a good idea, or maybe somebody wants to help give you some money for it. You just start talking about your film. And when I was talking about this film, 100%, like there's no exaggeration when I say every single Black woman that I talked about making this film, they said they had a negative experience at some point with the U.S. healthcare industry, like 100%. And it was not just with like in birthing, but it was across the board. Every single woman, I would say 70% of white women had a problem, had some sort of thing happen to them. So that to me was, just still continues to shock me. That was like the biggest sort of impact that I have, and the story that I will tell every single time that I have one of these events, because I could have the stories that the long sort of monologue stories, I could have made a 3-hour film of just those, because I have so many of those stories. Yeah, that's the biggest thing for me.
Thank you. Ms. Hakima, amidst the flood of news stories and reports highlighting the stark disparities, and we talked about the disparities, the difference in how Black women and white women are treated when they just go for a checkup, right? But just with Black maternal health outcomes, how do you perceive the role of Black doulas in reshaping the landscape of Black maternal health within our communities?
Great question, because I think Black doulas are really reshaping the conversation around maternal and infant health. I'm working now on my dissertation on my PhD, and the focus of my study is the Black doula. So I'm intensely interested in the role of the Black doula, and I do see Black doulas as kind of the secret sauce, but what exactly are they doing, and how are they doing it that impacts health outcomes in a positive way? I think that's a question that's still largely unanswered. We know that they're making a difference, but how? What is it about what they're doing or what they are doing that's making the difference? But I absolutely see them shaping the dialogue. I'm actually moving in my interest. I've sort of floated from patient care to training and education and healthcare advocacy. Now I'm moving more to the policy side, and it's because of doulas to make doulas a more accepted part of the healthcare ecosystem in this country. I've had to, along with others who do the same kind of work as me, we've had to visit our state houses, we've had to educate legislators, we've had to talk to state regulators and state health policy makers to move us toward normalizing doulas in our system. And I've been a part of the work of Medicaid reimbursement for doulas. I'm really proud of that work, and our state of Kansas next door just recognized doulas and made them reimbursable through Medicaid, and Missouri is very soon to follow, probably before the end of this year. And so they are very much shaping that conversation, because I'm loving the way that hospitals and those kinds of healthcare systems can no longer ignore the presence of doulas now that they're being reimbursed through insurance, private and public insurance. Hospitals are going to have to take note. And I turned 62 this year, so I've seen a breadth of institutional change over time, and it was always driven by consumer outcry. I believe in the power of the healthcare consumer, and when they gather together and say, hey, we want this or we don't want that, hospitals do eventually listen, and they do make change based on that. And I'm seeing that same kind of trajectory of change with the normalization of doulas, with listening to doulas' approach, understanding what doulas are bringing to the birthing arena. A shift is absolutely happening, and I'm thrilled about it. I'm thrilled that a city councilwoman and the director of our health department are here representing and talking about the changes made in our city's healthcare policy because of the advocacy work of frontline doulas. And those things are happening, and our city has responded to it. And I love to see that. That's what I want to see. That's what it's going to take. And as consumers demand better health care, they will begin to receive better health care.
And that's us advocating. We have one round of questions for each of our panelists to answer, but get your questions ready, okay? We have a mic in the center, so whenever you're ready, we're going to call upon you. But this last question, same question for each one of y'all, repeat it if necessary. Dr. Jones, I'll start with you. What is one action community members, policymakers, and organizations can take to build power, resilience, and liberation for the Black birthing community?
I believe that one of the most important steps that we can take, and I'm going to speak from the perspective of the system because, I feel like we are in some ways a part of that. We are a part of that system. It is to be unafraid to share the data that's not just the data about our outcomes, but the data about the sources of those outcomes. So not from necessarily a punitive standpoint, but more from the standpoint that Ms. Hakima mentioned, which was around just awareness and getting people to come to the table. We know that if we can say, hey, people continue to come to this place, and out of the 50 people who visited your L&D department this month, I'm sure it's more than that, but the 50 people, 30 of them said the same thing. 30 of them said they were ignored when they asked about this. Like, this information needs to be public. I think we continue to run up against some challenges with people feeling as if that data would be used against them, and we know that healthcare is a very competitive, very finance-driven field, and so that's not something that has been easy to do. But I can't get around the accountability aspect of really helping people see this is the source of it. Everybody's telling a story. They asked for this, they didn't get this, they were ignored when they said this was wrong. What are you doing to address that?
So, Director Emmett, the same question for you. What is the one action community members, policymakers, and organizations can take to build power, resilience, and liberation?
Go to sisterdoulafilm.com.
I love it. I love it.
And share
Absolutely.
for me it's I have an amazing event producer, co-producer, Sandy, and she has me she doesn't like have me come to these things, but I'm always like, Sandy, I'm the least important person here. I'll just like wave and then walk away because I want to hear from Hakima and the professionals. And so I think it's creating events like these and like getting the word out and having sort of community gatherings that I've just found they're just really great places to educate the people that you want to be educated. It's so simple to invite friends to a small event at Uzazi Village. So I think it's just being brave enough to say, hey, this is a thing that's important to me. Come to this event. Let me help educate you. And maybe, the word will sort of spread in a grassroots sort of way. Yeah, that's what I do. sisterdoulafilm.com.
I love it. Ms. Hakima, this is you. This is your passion. This is what you have been called to do, and we saw it in the credits. Over 500 doulas you've trained. You've been a part of their life of shaping. One action. Tell us what we need to do to make sure that this is prevalent in our community.
Well, I would say simply, and I'm speaking to healthcare consumers, vote with your feet and abandon those systems that have abandoned you. So I'm very proud of the fact that so many of our clientele at Uzazi Village are seeking out-of-hospital birth options, be that a local birth center or a home birth option if they medically qualify for a home birth with a midwife. But so many of our clients come to us seeking those options because they don't want to deal. The doula is your companion in a hostile system, but what if you remove yourself from that system? Not that those are options everyone can exercise. Not everyone has a birth center in their community. Not everyone medically qualifies for a home birth with a midwife. But for those who do, consider those options because hospitals, healthcare organizations are businesses, and they're dependent on that revenue, and they're dependent on that exposure that birthing, that maternity wards give them. I believe it's understood that the female of the family guides the healthcare decision making and decides, which hospital. So if she has a positive experience at your facility having her baby, then she'll have her husband go there and her dad go there, yeah, you know, she'll talk up the whole facility to the rest of her family members, and then if she has a negative experience, the opposite can occur. So I want hospitals to work harder for our business and not simply give it to them, and if we're dissatisfied in that environment, look for better, higher quality environments for our birthing experiences.
Thank
So
you. Appreciate
vote
that.
with your feet. Walk away if it doesn't serve you.
Absolutely.